ABCSG18 is a trial of Adjuvant Denosumab in postmenopausal breast cancer patients with hormone receptor positive disease. We all know that adjuvant endocrine therapy, particularly with aromatase inhibitors, causes bone problems, osteopenia, treatment-induced osteoporosis, and fractures. So the aim of our trial was to investigate whether Adjuvant Denosumab at the dose of 60 milligrams twice yearly would affect bone health, and we also have secondary outcome endpoints that will be presented later. There were 3,425 patients randomized in this multicenter trial in 58 centers. They were randomized 1-to-1, either to receive denosumab, 60 milligrams twice yearly, or placebo at the same schedule. The primary endpoint was time to clinical fracture, and that was defined as a new clinical fracture with associated symptoms. Patient composition, this was a very average postmenopausal breast cancer population. About 72% of patients were node negative. 3 out of 4 patients had adjuvant aromatase inhibitor treatment only, and 25% had additional chemotherapy. We were able to show adjuvant denosumab basically cut treatment-induced fractures in half. So the hazard ratio of the difference was 0.5, obviously a highly statistically significant result. We also demonstrate secondary bone endpoints, so that's not a surprise. Adjuvant denosumab increases bone mineral density and it reduces vertebral fractures, which were both secondary endpoints of the trial. Also very important in an adjuvant trial is safety, and we did not see any additional toxicity. We were specifically looking for osteonecrosis of the jaw with a proactive monitoring program, and there was no case of osteonecrosis of the jaw. We did neither observe any atypical fractures. What is important, I believe, is that in this trial, focusing on bone health, we were able to see that in fact the fracture risk of postmenopausal patients taking aromatase inhibitors is substantial. Within 3 years, 9% of patients in the placebo group had a clinical fracture, breaking a leg, a wrist, and this was cut in half by adjuvant denosumab. So we may have underestimated in the past the true fracture risk of these women, which makes our results more relevant. And I think it's exciting news for patients that with a relatively simple intervention, just 2 subcutaneous injections per year, you can cut this risk in half. So I believe that this is going to change clinical practice, depending on how the uptake in the scientific community will be. And it's exciting news and new benefits for our patients.